in signals intelligence, communications intercepts. So yeah, you can definitely have an operational impact in the future.
Morgan Wright, some scary stuff there. Morgan Wright is a cyber security analyst. Thank you.
Well, right now the doctors are in with a brand new front in the war on cancer, rallying the power of a patient's own immune system to fight the disease. Instead of the usual treatments you might be familiar with, like chemotherapy, for example, new drugs and practices transform the body's immune cells, leaving doctors with stories of nearly miraculous results in some of the most desperate cases. We'll get to that in a moment. What we're talking about is immunotherapy. Let's welcome three of the country's leading oncologists. Dr. Stan Gerson is the director of University Hospital's Seidman Cancer Center. Dr. Padmani Sharma is a medical oncologist at the University of Texas MD Anderson Cancer Center, where she oversees immunotherapy trials. And Dr. Jed Wolchuk is the chief of melanoma and immunotherapeutic services at Memorial Sloan Kettering. You all get the awards for the most impressive resumes on our air for today, but it's great to talk to all of you as we take a look at what could be really a hopeful sign in this battle against cancer. Dr. Wolchuk, let's just start with you. Can you just tell us what exactly is immunotherapy?
So, first of all, thank you for having us. Immunotherapy is an effort to try to use the body's own immune cells and organs to fight cancer. We know the immune system is very good at eradicating or controlling infectious diseases like bacteria or viruses, which are dangerous threats to us. And we now know that the immune system can be directed to targets on cancer cells to eradicate them in some cases as well.
So, Dr. Sharma, how do you do it?
Well, basically at this time, the immune system had to go through a lot of different basic science research for us to understand what turns it on and what turns it off. And so now that we understand that they're on and off switches, we have learned that we can block the off switches. And by blocking the off switches, the soldiers of the immune system, the T cells, can then continue to attack cancer cells without being stopped by these off switches. And that's what leads to the tumor regression in these patients and the long-term survival of these patients, because the immune system is sort of a living being within you, and it continues to do its job for a long time, even after you stop giving the drug.
It's fascinating, Dr. Gerson. I wonder if you could give us an example where you've seen this actually work, where you've seen a tumor shrink or disappear.
Well, we have patients with non-Hodgkin's lymphoma, with melanoma. That's been the biggest example, certain colon cancers, and even some lung cancers, in which patients were desperate at the end of the road, if you will, from our conventional chemotherapy, who've had dramatic responses, new lives given to them for extended periods of time.
Dr. Wolchuk, have you seen the same thing in your practice?
Yes. I mean, we started off using these medicines in patients with melanoma who had very few good treatment options before 2011. And between 2011 and now, we now see the median life expectancy of someone with melanoma moving from 7 months to over 2 years. And as Dr. Sharma said, many of these responses are durable. What's been particularly rewarding is to see these same treatment approaches being applied across many different diseases.
And Dr. Sharma, you have some interesting examples as well of people even coming up to your husband at the airport. Because your husband is also a doctor, I should mention. You're both in this field together. He'll have to join us next time so we can make it a family affair. But you've also seen some incredible things.
Yeah. Absolutely. We've had patients come up to us, and even in my own clinic, where my patients are now returning over and over and over years later. You know, they come in the beginning and they say, you know, I just want to live a few more years to see my child graduate or something, and now they're here 10 years later and doing very well. So I think it's very promising therapy, and we're very excited.
So here's the big questions. Is this actually the cure for cancer? What are the side effects, and what about the costs? We're going to tackle those questions after a quick commercial break. We'll be right back.
You can run an errand, or you can take a joyride. Bye-bye, errands. We sing out loud here. SiriusXM, Road Happy.
You owned your car for 4 years. You named it Brad. You loved Brad. And then you totaled him. You two had been through everything together. 2 boyfriends, 3 jobs. You're like, nothing can replace Brad. Then Liberty Mutual calls, and you break into your happy dance.
If you sign up for better car replacement, we'll pay for a car that's a model year newer with 15,000 fewer miles than your old one. Liberty stands with you. Liberty Mutual Insurance.
This is the summer. The summer of this. The summer that summers from here on will be compared to. Where memories will be forged into the sand and then hung on a wall for years to come. Get out there. Find hotels at up to 50% off and more ways to save at Expedia.com/save50.
When my doctor told me I have age-related macular degeneration, AMD, we came up with a plan to help reduce my risk of progression. And everywhere I look, I'm reminded to stick to my plan, including PreserVision AREDS 2. My doctor said PreserVision AREDS 2 has the exact nutrient formula that the National Eye Institute recommends to help reduce the risk of progression of moderate to advanced AMD after 15 years of clinical studies. PreserVision AREDS 2, because my eyes are everything.
Constipated? Trust #1 doctor recommended Dulcolax. Use Dulcolax tablets for gentle overnight relief, suppositories for relief in minutes, and stool softeners for comfortable relief of hard stools. Dulcolax, designed for dependable relief.
At Safelite, we know how busy life can be. These kids were headed to their first dance recital when their windshield got cracked, but they couldn't miss the show. So Dad went to the new Safelite.com, and in just a few clicks, he scheduled a replacement before the girls even took the stage. Safelite.com is the fast, easy way to schedule service anywhere in America, so you don't have to miss a thing. Hey, y'all did wonderful. That's another Safelite advantage.
Safelite Repair, Safelite Replace.
At Ally Bank, no branches equals great rates. It's a fact, kind of like bill splitting equals nitpicking.
But I only had a salad. It was a buffalo chicken salad. Salad.
You can sit in traffic. Or you can crack up. Sorry, traffic. We laugh till it hurts. SiriusXM, road happy.
We're back talking about hope when it comes to the field of curing cancer, and we're back with Dr. Gerson, Dr. Sharma, and Dr. Wilczek, oncologists that are on the cutting edge of their field when it comes to immunotherapy. And just to sum that up quickly for our viewers, when you have cancer, essentially cancer turns off your immune system, so your body can't fight it. And so what immunotherapy does is that it helps turn your immune system back on to go ahead and try to tackle that cancer. Dr. Gerson, can you tell us a little bit about how did you give someone immunotherapy? How does it work?
Well, the medications are oral medications or they're antibodies, and one can receive them intermittently as with other treatments that we use for cancer, and they can be given alone or they can be given in combination with other conventional chemotherapy drugs or even with radiation therapy. But there's a huge amount of research going on still about how to properly give the medications at both the right doses and to avoid toxicities.
Dr. Wilczek, it sounds a lot different than chemotherapy. And when you see someone that has been through chemotherapy, you can clearly see how it affects their body. What's the side effect of some of these drugs?
The side effects of these medicines is clearly different than chemotherapy. The side effects can really be characterized as being inflammation of various organs in the body, most commonly either the intestines or the thyroid gland, sometimes the skin or the liver. These side effects sometimes are not evident to the patient because they just represent abnormal blood tests, but some patients do describe significant fatigue, can have some gastrointestinal symptoms, and when side effects occur, it's important that people share this information with their doctors, and we often use immune-suppressing medicines to try to control them.
Interesting. Dr. Sharma, you point out that sometimes this works incredible for some people, sometimes it doesn't work for others. Sometimes a person goes on and off these drugs, but according to what you've seen, even if they come on and off the drugs, sometimes there's lasting effects.
Absolutely. These responses can be durable even after we stop the treatment. And that's because, again, these agents are treating the immune system. They're not targeting the tumor cells per se. And by treating the immune system is the same system that has these cells circulating in your body for the rest of your life. And if they learn how to attack cancer, they remain there and they have what we call memory or memory cells that can then start that whole response again if they need to.
So, Dr. Gerson, what about cost? What about access? Because I'm sure there's going to be folks that are listening to this thinking, wow, this sounds really great for my, me or a family member or somebody. How do you get immunotherapy?
So given the fact that these are new medications and there's been billions of dollars of research that's gone into them, they are expensive, and that's why the FDA has only approved for a certain number of indications, and a patient needs to go to their physician to determine whether or not their indication is appropriate. But we all agree that there's plenty to be done, and there are many clinical trials around the country that are opportunities for patients for new therapies in the immune space.
And it sounds like there's a few different cancers that, Dr. Wolchuk, that perhaps are more responsive than others, and maybe we can talk about that in just a moment, but I have to ask you all a question. Is this, when you think about your work, do you believe that this is the cure for cancer, Dr. Wolchuk?
I think that this is one approach to try and control cancer in a very durable way. Cure is a really emotionally charged word, and we don't really know precisely how to define it. But I think that immunotherapy, either alone or in combination with other approaches, can result in durable disease control in a significant number of people with some diseases. The challenge that we now have, the research areas that we focus on, are how to expand that.
Dr. Sharma, cure or maybe not?
I agree that cure is an emotionally charged term, but so is the word cancer, so I want to throw cure in there against cancer. I think we need to start thinking of this in hopeful ways, that maybe we can cure some patients, and we have seen some patients now that we've considered cure, actually. So I think immunotherapy is another pillar. By itself, I don't think it can do it, but it's one of the pillars with radiation, chemotherapy, surgery, molecularly targeted agents. I think we now have lots of different agents we can use together to head towards cure.
I only have a quick 20 seconds here, Dr. Gerson. Your thoughts on this?
So I think we can cure some patients, not all. And I've been doing stem cell transplants for lymphoma and leukemia. We cure those patients, and we realize now it's all about the immune therapy they're receiving as part of their stem cell transplant.
It's really a pleasure to have you all on the program. We know that you're busy, and taking time to do television may not be a top priority, but it gives us the opportunity to really learn about something incredible that's happening, and to thank you as well for your work. Thank you all for taking the time to join us.
Thank you.
Glad to.
Thank you.
Some great news there. North Carolina will be a crucial state to watch in the presidential election, but all eyes are already on a big down-ballot race there as the show